Well, as you can see, we're here in an empty Charles Hunt room, but that's not to say that tonight's GHA public meeting was not well attended. It actually was. And the Director General, the GHA's Director General, Professor Patrick Gagan, said he was going to speak about the good, the bad and the ugly. So a look back at the last 12 months, areas that need improving and areas where there's been investment. So the main message is that patients are safe with the GHA. That was his main message. So £2.6 million spent in capital investment over the past year, and the areas where the money has gone into, a new theatre is set to open next week, he said. There's the new sterilising unit, completion of the ENT unit, IT equipment and fire safety. He did say that the hospital was ageing, so there's a 3-year plan for its refurbishment and for infrastructure. Some of the money, of course, also used to lease out equipment, so expensive equipment, such as a second CT scanner and a cath lab, and that's going to be operational leased over the next year. And service reviews of the years included in dentistry, maternity, orthopedics and A&E. Professor Gagan highlighted the importance of patient feedback. And we know that there's a group that goes around the hospital asking patients what they think of the services. And he also highlighted the importance of transparency within the GHA, and more data, he said, will be made available so that people know what's happening and so people can have facts at their fingertips. But what needs to be done? Well, the GHA says it needs to address waiting times and tackle effective use of resources and long-term conditions. So, as we know, we've spoken about this at the last meeting, there's the rollout of the mobile health unit, and that's an ambulance that will be going round the estate so that people can go, so that the health authority can go to them as opposed to people having to take up hospital or primary care time. Out-of-hospital care and addressing workforce issues are things that still need to be done according to the GHA. So where is the GHA going to get its staff from? Those are things that the GHA wants to be looking into. To deliver its priorities, it will be signing off a 3-year strategy plan that will serve as a roadmap. And questions tonight, once again, on that MRI scan. When is that going to happen? And we heard that there will be an MRI scan within the next few weeks, and that's in Gibraltar. So we're not sure whether that's going to be in the hospital itself, but the GHA has said there will be access to an MRI scan on the Rock. And another interesting piece of information was that the GHA is carrying out, or at least Public Health is carrying out, a study on vaping. And those were some of the questions that were asked tonight at the public meeting.